Good morning. I first of all want to thank UNU-WIDER for the opportunity to present this ongoing research that we have prepared among my colleagues, Valeria Paz and Wilson Guzman. Presenting right now the outline, I will start with an introduction and a motivation of this research. For the year 2022, 149 million children under the age of 5 were suffering from stunting globally, and 11.5% of these children are in Latin America. Ecuador ranks second in the region, right after Haiti and before Guatemala, on having the highest prevalence of stunting. So therefore, this problem is something that we would like to address. Stunting is a very important problem because it has effects not only in the short run, but also in the long run, related with physical and cognitive development. So early interventions are very important as there is this opportunity window that occurs during the first 1,000 days of life. If we have public policy to stop stunting during this opportunity window, the long-run effects are going to be good. So Ecuador and the government of Ecuador in exactly the year 2022 started a national strategy named Ecuador Grows Without Stunting. And I want to talk about a little bit of how this strategy works. It is a cash transfer that is named Bono 1000 Días, and it has two components. A first component that is an unconditional component that addresses especially mothers since pregnancy until the first 1,000 days of the child. They will receive $50 each month if they accomplish some conditions, such as being poor. We rank that with an RS score that I will talk about later on. I will explain how it works. And they should not receive another cash transfer, and they cannot be part of the social security system neither. That is part of the conditional component. Now on the second part, that is the conditional component, there are milestones that the mothers should accomplish in order to get the money. So there are 3 milestones that they have to accomplish. The first one is that during pregnancy they have to attend prenatal care evaluations, and once the children is born, they have to register the birth at the civil registration office. If they do that, they will receive in total $90 maximum. The second and the third milestones are related with monthly medical evaluations for the rest of the months, and they will receive $10 per each evaluation and $120 in total per each milestone. So the question that we came up with is that we would like to know what is the impact of Bono 1000 Días program on childhood stunting in Ecuador. So in order to answer this question, we have used the names in Spanish are always so long, such as my own name. I will just call the database as Susan because the name is very long, and this database it compiles different data sets from different institutions in Ecuador, such as the Social Registry, Ministry of Health, and Ministry of Social Inclusion. So with this information, we have our running variable, which is the Z-score, or AJC, which is the height for age, and of course the treatment variable that we're going to use is the bono mil días. The assignation variable is the social register score, named also SELVEN, which is an index that has the cutoff of 29.77, and the households who are above this cutoff are considered poor. So if the household of the mother, which is the recipient, and the children, who's the beneficiary, are considered as poor, they will meet the condition to receive this cash transfer. So after checking the information, we realized there is an imperfect compliance. So the method we're going to use to estimate the impact is a ViewCRD design. For the first stage, we follow the suggestion of Gelman and Invens, and we add second-degree polynomial. And then for the second stage, we have estimate the effect on the Z-score of bono mil días. So the results we found are quite important, as we found that the effect is of increase of a 0.29 standard deviations on the Z-score compared to the expected growth on a reference group. In order to prove the robustness of our results, besides these parametric estimates, we also estimate non-parametric estimates, and the results we found confirm the parametric estimates findings of our estimations. So the bias-corrected robust estimate that we found is of 0.27 standard deviations. So the policy implications of what we have estimated and the results we have found are important. Has a child to be considered stunted has to be part of the -2 standard deviations compared to the expected growth in a reference group. Therefore, these findings are important and meaningful. Some other policy implication is that this conditional and unconditional cash transfer have been effective. It's a tool that is effective to reduce stunting and malnutrition in countries like Ecuador. And the investment per child is not that high. It's a maximum of $380. And this investment can change the life of a child. So our parametric and non-parametric estimates are robust and suggest this effect of around 0.27 and 0.29 standard deviations increase. And investing during the first days of a newborn life can prevent children to falling below the standard deviation that defines stunting. We have found consistency among the parametric and non-parametrical approaches, and this reinforces the internal validity of our design. So, as I said, this is an ongoing work. So all the comments and suggestions that you can make are welcome. Thank you.